Hi, good morning. First off, I'd like to thank everybody for taking the time out of their day to come listen to my presentation. I really do appreciate it. My name is Caleb Fuller, and today I'm going to be talking about nurse-physician collaboration. So first off, I wanted to talk about just collaboration in general. What is it and why do we need it? In healthcare, collaboration is defined as a complex phenomenon that brings together two or more individuals, oftentimes from different professional disciplines, who work to achieve a shared aims or objectives. In our environment, different healthcare professions that we interact with on a daily basis include working with the blood bank, microbiology, cytology, radiology, different units, different floors. We're constantly working together with multiple different professions to provide the highest quality of care to our patients. The ANA takes defining collaboration a step farther by breaking it down into four major components. These components include a partnership with mutual valuing, recognition of separate and combined spheres of responsibility, a mutual safeguarding of each other's parties' interests, and recognizing shared goals. So why is collaboration needed? Evidence has shown that collaboration actually reduces the risk of adverse patient outcomes. As you can see in this chart here, preventable medical errors is one of the third highest leading causes of death in the United States, costing the lives of nearly 440,000 people each year. Research from the Joint Commission has actually shown that nearly 70% of patient-involved adverse events cited a lack of collaboration and communication between providers as a main cause of the error. Besides reducing the risk for adverse reactions, collaboration also enhances our working environment. Collaboration has been shown to induce higher levels of work satisfaction, reduce turnover, and has decreased healthcare costs as a whole. I want to talk specifically about nurse-physician collaboration. Although each executes his or her role in an efficient and effective manner, they must work together synergistically to ensure positive and consistent patient outcomes. I love the term synergistically. Yes, nurses can take care of their patients individually, and so can physicians, but by working together, the quality of care that they can provide to their patients is greatly enhanced. It's a synergistic working environment. So the status quo, and you guys can each self-reflect and think about your own working relationships with your physicians in different healthcare professions. Research has shown that many physicians view the working relationship as adequate, while a lot of nurses report that there's room for improvement. And you can see that exemplified in this chart. The physicians are giving it a thumbs up, and the nurses are showing that it's a red X arrow. So central to collaboration is good communication. And you can see I posted a comical cartoon over there, but in all joking aside, communication is essential to collaborating in an efficient manner. Poor nurse-physician communication threatens patient care and undermines a collaborative organizational culture. So next I want to talk about, in a couple of different slides, some of the barriers that inhibit adequate collaboration. I think a big one right off the bat is stereotypes. You can kind of see in this diagram, stereotypes are a major way inhibit positive communication. Thinking that physicians are always busy, are always on the phone, or that nurses are always sitting on a computer and charting. These negative stereotypes hinder an adequate working environment. A couple other barriers include years of experience, differing patient care responsibilities, different culture, socioeconomic statuses, and believe it or not, gender. Gender influences communication between nurses and physicians by men tend to prefer clear, quick, and fact-based communication, whereas women may prefer a more in-depth discussion style that attempts to understand the reasons of occurrences. So just acknowledging these differences can actually reduce these barriers. A couple more barriers. I think this next one shows time pressures, and you can see on these pie charts the different roles and responsibilities that us as nurses and physicians alike have throughout our daily practices. It's important to respect and value each other's time. It's easy to think that the grass is always green on the other side, and that people, if they're not visibly working in front of you, they're not always working hard, but we each have a lot to take care of in our daily roles. A couple other barriers are knowledge, variances in knowledge, differing educational background, perspectives, and organizational culture as a whole. So now that we know what are some of these barriers, how can we improve our communication? Organizations that successfully created a team culture have produced better patient care outcomes through coordinated care. So how do we accomplish this? Well, research has shown an improvement in nurse-physician collaboration by implementing weekly team-focused meetings aimed at developing collaborative solutions to communication issues. So getting together and talking about how to communicate better will show an overall improvement in our collaboration in a working environment. Meeting together on a weekly basis can be difficult. I know it's different with all of our work and patient care responsibilities. I know we generally meet once a month right now as a team, and this is a great time to bring up ways to enhance communication or try different means of communication, and to try to make some different implements into our daily practice that can improve our working environment. Tools for success. Evidence-based practice solutions have shown even basic tools such as greeting each other and introducing new staff can enhance collaboration. Establishing a collaborative communication structure. I think we do a great job at using the term clarity. Whenever somebody says, can I get a little clarity on this situation? It's kind of a time, it creates a pause and decreases a hierarchy of barriers between physicians and nurses, and a way for them to clearly communicate. Another structured communication tool is the SBAR, and you can see it here. It stands for Situation, Background, Assessment, and Recommendation. This is another communication tool that can be used or written or via email, and it simplifies communication. You're breaking down a problem, the assessment, and how to resolve it. It's a great communication tool to use to get problems solved. Okay. Couple others, increasing opportunities for sharing. So again, just setting time to talk about how to communicate better enhances collaboration. Two more. Establishing specific procedures to eliminate unnecessary phone calls. So for us in the OR, we all have, a lot of physicians have pagers. Knowing when to direct call and to text page can make a big difference in flow and enhance communication. And then the last one is chain of command. Just utilizing chain of command can reduce some unnecessary communication and clutter and streamline efficiency in communicating. In conclusion, nurses and physicians who demonstrate genuine respect for one another and their contributions produce better patient outcomes and show increases their own as well as their patient satisfaction. So mutual respect, guys. Just respecting one another's time, occupation, achievements, patient care. the key, and you can see in the chart the cycle of respect. You give respect and you get respect back, and I think that's essential. I appreciate you guys again taking the time out of your day to listen to my project. I hope that this will make us a little more cognizant about how we interact on a daily basis, and hopefully give you some tools and tidbits that can help. And those are my references. I'll hang around for a little bit if you guys have any questions. And again, thank you for your time.